Hi guys, I thought I'd talk a little bit about back pain today. What causes back pain? It seems to be very, very confusing for people, but let's go through this a little bit, okay? In chiropractic, there's a term called the vertebral subluxation complex. Woo, it's a big word, but I think most of you understand what vertebral means. It's basically talking about the bones of the spine. They sit in your spine all the way through there. Each one of those is called a vertebrae. Subluxation is a term called, it's less than a complete dislocation of a joint. So you can imagine if someone tore the arm out of their socket, that's pretty damaging to the tissues all around it. A subluxation would be less than that. So the alignment's off, so you're moving it around and it damages the tissues and causes problems. Now, the thing is with the vertebral subluxation, it's a complex of different things that happen. There's actually 5 different things. The first one, though, is the cause point for the other things, and that is abnormal motion or position of the spine. You can imagine if there's something that's not moving right, you get it to move right, the pain goes away, everything is handled. But what if the position's wrong? What if the position of the spine is in an abnormal position? Those things are now causing abnormal motion and also these other products of this. So this here, this one component, sets in motion the other 4 components. So if you have an abnormal position that's causing abnormal motion, it's going to start creating symptoms elsewhere in the body. It may be irritating the nerves, so you start feeling arm pain. It could cause chest problems. It could pain down the leg. It could cause intestinal problems. Could even cause acid indigestion. You can have muscle spasms. So muscle spasms can occur in the spine because there's abnormal motion and position. A person who has muscle spasms in their back definitely can't just have muscles and spasms in the back. It has to happen because there's some kind of abnormal motion or position of the spine. You also get inflammation and soft tissue damage. Just like if you had a bruise on your arm and I pushed in it, its tissues are damaged. So when there's abnormal motion or position of the spine, it starts breaking down those tissues. So it creates inflammation and damage. As that goes on, most people, what do? They take an anti-inflammatory, which doesn't help the healing at all. The healing occurs when you actually change the motion and position of the spine so we can actually take the stress off those tissues so they can heal naturally. The last thing, if it goes on for too long, you start getting bony changes or spurs that occur. And people always say, gosh, yeah, I've got arthritis in my spine. Hey, it's an age problem. Why is it an age problem? If I've been doing this for over 30 years, you're looking at a spine, all of those look great except for one area. It's all broken down. That's arthritis. It's not age-related. It's because there's been abnormal motion and position long enough. Those tissues are broken down, and the body is trying to compensate by increasing bone mass there to support the abnormal stress on that area. So that's what causes back pain. So if we have good motion, good position, that'll help. Now, some people say, well, gosh, I go to yoga, and I get really good flexibility. If you have an area that's not working properly and you're doing something that's actually stretching the tissues out that are already moving, you can actually have a big discrepancy between areas which can also put abnormal stresses and lead to the same thing. If you're exercising, exercise is great, but if you actually have abnormal motion, it's going to accelerate the damage. You can imagine if you had an alignment off in your car, and you brought it in, you said, yeah, my tires are bad. And they go, yeah, these bad tires, let's just replace the tires. But they never handled the alignment of the car. You're going to still have a problem. So it's always a position problem or a motion problem in that area. So I thought I'd tell you a little bit about that today. So anyway, I hope that helped you out. Thanks. If you're interested in learning more about how to maintain an active lifestyle as you get older, please subscribe so you can get notifications. Thanks.